It has never been more clear that we need a new response to meet the mental health needs of our youth. The social, emotional, and behavioral needs of students has never been more prevalent in our country, and the need continues to grow. Suicide has gone from the fourth leading cause of death to the second leading cause of death among youth and young adults. 1 in 6 youth experience a mental health disorder, and only about 50% of those youth receive treatment. Lack of student access to treatment leaves schools as informal mental health providers. Which is okay because school mental health research says youth are more likely to complete treatment when offered in school settings. The increasing need of our youth and communities makes it time to break down silos of service delivery and focus on a whole population response. Schools have been using a prevention-focused tiered logic known as PBIS to organize and allocate resources to support behavioral needs of students for decades. And school-based mental health has grown during this time period as well. While powerful and more effective to have supports within schools, often school teams and community partners still work in isolation, not knowing the supports the others provide. The interconnected systems framework draws on the strengths of both systems to create one single system of delivery. While focusing on increasing the confidence and competence of all school staff to rigorously and continuously support the mental health of all youth. Creating this integrated way of work takes systems change. There are no quick fixes, and common responses will not be sufficient. For example, we cannot simply hire more social-emotional experts, or buy a new social-emotional curriculum, or simply train more staff in trauma awareness. Instead, we must alter our systems so that we utilize the social-emotional behavioral expertise of school and community clinicians on teams that are selecting evidence-based practices together that align with the need of the community, the resources available, and the capacity to implement. To define one continuum of supports matched to the needs of their students, families, and staff. Then use data to drive how students enter and exit interventions, helping move away from a traditional referral handoff approach. Integrated universal teams can focus on prevention by using data to expand and prioritize the social-emotional competencies being taught to youth, and align the skills within existing systems such as our school-wide matrices to create consistency. Then we must invest in ongoing coaching to build the competence and confidence of all staff to embed social-emotional teaching alongside academic content. Sustainable change comes from systems change, and the ISF provides the structure and processes to enable this change to occur. If you are ready to begin an integrated way of work, see Video 2 for an introduction to using the tools and resources available within Volume 2 and Implementation Guide.